Hey guys, Kim from Think On. Just wanting to jump on here and do a quick video, busting some myths actually that I'm hearing overseas nurses doing when they're practicing and preparing for the New Zealand OSCE exam. Now, you can do these things by all means. It's not going to cost you marks. However, it is going to cost you a lot of time and perhaps a lot of unnecessary time. And let's face it, you only have a short period of time to complete your OSCE. So the more time that you can create or get out of your OSCE, the better it will be. I just want to say as well, like these three myths that I'm going to talk about, hand hygiene, gaining consent, and also verbalizing everything you're doing out loud. So the myth one, right? You must wash your hands every single time you take a new set of vital signs or a new vital signs. And many nurses are believing that during an assessment, they must wash or sanitize their hands before every single vital sign. That means, before you even start, you're washing your hands, right? Yep. That's excellent. You need to do that. It's part of the 5 moments of hand hygiene before you touch a patient. Then you do your first blood pressure. You're washing your hands again. Then you're taking the patient's temperature. You're washing your hands again. You're taking the patient's heart rate or pulse. Then you're washing your hands again. You're observing the patient's vital respiratory rate. You're washing your hands again. How many times do you need to wash your hands during taking a set of vital signs? Unless this patient has some type of contamination, like MRSA or gastro outbreak, or there's vomit or blood on the scene, there's no need to be washing your hands, and yet you'd be wearing full PPE anyway, and you would be wearing gloves. So let's not overthink these things. As registered nurses with skills and knowledge, we should not be washing our hands 100 times after every single tiny vital signs. 1, the patient will wonder what you're doing. 2, it's unnecessary and you're going to get very sore hands. You wouldn't be doing that as a normal registered nurse when you're caring for a patient. Yes, of course, if you're changing environments and then you're coming back to see your patient, again, we need to make sure we're managing and maintaining the 5 moments of hand hygiene. But if you have met your patient, you've explained the procedure to the patient, you have washed your hands before you started your set of vital signs or assessment, it doesn't have to be just vital signs. You do not need to keep washing your hands unless you're then cross-contaminating yourself, okay? So that's one myth. You do not need to wash your hands. However, there is, times in which, for example, if you're doing a wound assessment and a dressing change, yes, you're going to be washing your hands at multiple stations or steps during your wound assessment and dressing change. But with simple things like vital signs, there's nothing to keep washing your hands in between. You're not cross-contaminating with anything. So let's just forget about doing our hand hygiene every 5 seconds when we're doing the vital signs. That's going to save you at least a minute, if not longer, on your only 8 minutes that you have. Okay? Myth 2. You must ask, can I touch you every time? All right? You're saying things like, can I touch you? So you're going to do the blood pressure. Can I touch you? You're going to then do someone's pulse. Can I touch you, or can I hold your wrist? Can I touch your ear so I can take your temperature? Every single time you're saying, can I touch you? And even just those 4 words, can I touch you, is a little bit weird in New Zealand, okay? Patients here, Kiwi patients, will probably find that a little bit odd, can I touch you, and maybe find it a little bit inappropriate. So, what you really need to do, okay, and this is what is really important, yes, you need to gain consent for your patient. And again, this is going to save you some time. At the beginning of your assessment, okay, you need to explain what you're going to do, why you're doing it, and checking that the patient is happy for you to proceed. Okay, so we have to say to our patient something like, I'm going to take a full set of observations now. This is going to include your blood pressure, your heart rate, and that includes me touching your wrist. I'm going to be taking your temperature, and I'm going to be popping a thermometer in your ear, and I'm also going to be observing your breathing rate. Okay? Are you happy for me to proceed with your set of vital signs? Yes. Okay, you now do proceed with your set of vital signs. You do not need to ask your patient and keep asking permission every single time you touch your patient. Okay, because you've already gained consent. You've already ticked that box. If there's a box that's about gaining consent or informed consent, okay, you've ticked that at the beginning. You do not need to continue to say, can I touch you? It sounds awkward. It's unnatural. We find it very unnatural, and in some cases inappropriate. Okay? So, give a good, clear explanation to your patient about what you're going to do. Your assessment or medication administration or treatment that you're going to perform. Give a full explanation at the beginning. Then ask the patient, are you happy for me to proceed? Done. Alright, so that's myth 2, busted. Then the third myth we're going to talk about today is you must say everything out loud. Okay, now this one's going to save you a bit more extra time as well. You do not need to narrate or take on board saying everything. So for example, you walk into the room, you've knocked on the door, and you verbalize, I'm knocking on the door, I'm closing the door for privacy, I'm checking the scene for safety. And why? Okay, the assessors are qualified, trained assessors, right? If you knock on the door, they can hear it. The patient inside, if it's a real live actor, is going to probably go, come in, all right? So tick, you just knock. You don't need to verbalize, I'm knocking on the door. This is not a memory test, okay? You are not robots. You are not actors. You are not there to recite a script. You're already qualified nurses. And this exam is checking that you are safe and competent to practice here in New Zealand in the healthcare setting. Assessors are looking for safe practice, professional communication, that you're following some type of systematic or logical flow in your thinking and your process. You're respecting your patient's privacy and dignity, and you're also using some clinical judgment and using some critical thinking, and could be escalating your concerns appropriately, using ISPA handovers, things like that. You're using your clinical judgment. They're not checking whether you can recite and rote learn steps. Okay? I understand that when you're training and studying for an OSCE exam, you need to know exactly what to do, when to do it, and you need to basically perform some type of robotic assessment. But let's face it, are you really going to do these things when you have a real life patient you're caring for? Or are you just going to fall into your natural subconscious way of being as a registered nurse? Now, yes, of course you can talk through things like, if you're doing a wound assessment, for example, you can talk through the steps that you might be doing in terms of that, if that helps with your thought process. However, doing things like knocking on the door, checking for scene safety, closing the door for privacy, closing the curtains for privacy. Now I'm going to do my 5 moments of hand hygiene. I'm going to wash my hands, palm to palm, fingers interlacing. You're verbalizing this out loud. The assessor can see you, right? They're in the room. They're in the corner with a clipboard. All right, they can see you, and so they're watching what you're doing, they can see it, and they're ticking it off as you go. So, final message. Over talking usually comes from anxiety and fear of missing something. But confidence in the OSCE comes from understanding what is being assessed, not saying more. Make sure it's clear, you remain calm, you stay professional. This is not a performance, this is not a script. Act like the nurse you already are. Most of you have years of experience, right? You're already qualified, you've spent thousands of dollars to study to be a registered nurse in another country, and you've spent many, many dollars coming here to New Zealand. So if you're rote learning and you're reciting steps out loud so the assessor can hear you, fine, they're going to tick the boxes, you might pass. However, save yourself some time. You don't need to do it. You do not need to wash your hands after every single vital sign when your patient is fit, well, healthy, or there's nothing of concern around contamination. You're not doing the blood pressure on this patient, going to do a blood pressure on another patient, going back to do his temperature, going back to do their temperature, right? You're not crossing over patient contact. You're here assessing the patient. You do your hand hygiene at the beginning. You can verbalise that your equipment's clean and calibrated. Again, at the beginning, it's done. Move on, get on with your assessment, so you've got time to do things like documentation, and have a conversation with your patient. Listen to your patient, okay? That's another key point just before I go, right? Listening to your patient, really important in New Zealand. Those actors will likely maybe test your abilities, test that you're actually listening to them. That actor might tell you the wrong date of birth, but you've asked them for the date of birth, they've verbalised one, you haven't cross-checked it with your documentation. What's that? A red flag, likely? Maybe, we don't know, right? Nobody knows how it's assessed or how OSCEs are assessed, because it's a high-stakes exam. However, these are simple, clear, basic ways to think about how you might be assessed in an OSCE exam. They're all basic nursing things that we do on a daily basis, right? We're all registered nurses. We do these things on a daily basis. So I think just have confidence in that. Be confident in your ability to communicate and also listen to your patients. And again, you do not need to be robotic, knocking on the door, checking for scene safety, verbalising out loud, if it's pretty clear you're doing it anyway, right? You do not need to do your hand hygiene every 5 seconds when it's inappropriate, as long as you're being safe and you're making sure that you're doing your 5 moments of hand hygiene. You do not need to verbalise every step of your hand hygiene because the assessor can see it, right? Just do it, right? Do it so they can see it, but you don't need to verbalise it out loud. All right, few hints and tips. Hope that helps. If you've got any questions, you can flick it in the box below on this YouTube channel. Subscribe if you want more videos. Ngā mihi, katoa.